Progress.
Okay, thank you. Okay, welcome to the February 3rd, 2025 meeting of the Yarmouth Board of Health. Just one note, and that this is a hybrid participation meeting. Simple as that. People can come to Town Hall, or they can Zoom in and participate that way. All the instructions are on the website, as usual. How about attendance next? Eric, are you here?
Here.
Mary?
Here.
Hillard, I'm here. Larry?
Here.
Charlie?
Yep.
Okay, let's move forward. That's done. First is public comment. It's opportunity for anyone in the public. This would be the opportunity to speak up. And if questions, we're open to them for sure.
I don't see anyone on the screen.
I don't.
Who's raising their hand?
Now's the time. Anything on the agenda? Anyone wants to ask questions, comments? This is the time. I don't know if anyone's here who would like to do that or not.
I'm just waiting to see as you proceed.
Well, this would be your time. If there's some things you want to say, this would be the time to do that, public comment.
As I understand it, this has been sent to your legal counsel.
No, no one can hear you. You're gonna have to go to a mic, introduce yourself so it can be put into the minutes. And that's the kind of the formality of this,
There we go.
as public comment
I
section
am
here.
Ross K. McCurdy, and I've got the latest, I believe, the revision of the draft of the bylaws for green home burial. And I believe this has been sent to legal counsel for the Board of Health, and then they're awaiting response from your legal counsel.
Well stated. That's exactly what's taking place. So we're sitting and waiting, and hopefully it moves along. Any comments there, Jay?
So after your last updates, I sent this over to the building department because they're referenced in there. So the building department, as far as setbacks, things of that nature, Mark Rills and his team reviewed that and they gave it the thumbs up. I then gave it to the Conservation Commission, just to get their sense, are there any concerns? Want to make sure it was comprehensive. What I didn't want to have is the board to move forward with something, and internally, we have a conflict or any kind of disruption. Conservation Commission, they gave us some advice, but said, by all means, again, they green-lighted it as well. On the 16th of January, I forwarded it over to the town legal counsel. They said that was, the 16th of January, and their response back was, we're on it. I haven't heard anything back. Once that, and I put this on as an agenda item, just simply so the board understands there's a progress, there's a cadence, this would move forward. Once you have the approval from the town council as far as legality and liability, perhaps, then you would be forward. Then you would be free to set a public hearing on that. You can then move forward, and then a hearing come. Maybe we invite some funeral director, whoever can come, whoever we want to come forward. But it would put some audience out there. So there's a process to that, and then a vote would happen, and then there's a 21-day waiting period and things of that nature. We're waiting right now for legal. I think, Ross, you said it well. That's the only reason it's on here, is we're waiting for legal to review this, town council.
Well, that's good news, though, that the other departments were
Yeah.
okay with it.
Great.
Well, it is. It is good, and Mary, to your point of being simply this, that internally we don't have it. Actually, there's another item that you have on the cranberry bog. I'll talk to you about that when that comes in front of you, is to make sure that we're all in agreement and there's a cohesive piece. Is that we don't want to have the board vote on something that is in conflict with another department. So
We didn't know that when we started out.
No.
Things weren't going smoothly.
No.
Looks like it's done nicely. Okay.
Yep.
so that's where we're at. So
So we're
hopefully that
sort of
answers-
doing this during public comment as a courtesy to you. Anything else? I know you make a long trip here for this, so.
It's okay. It's nice to see all of you, and I appreciate how hard you're working on this. And I think this answers all my questions on this. And so this basically checks off the agenda item for the green home burials here, right?
Yes.
I think so. Unless you had something else, I don't.
Yeah, that was exactly it. I just wanted the board to be
It was
aware.
cheating, okay? That's all. We put two things together. So, yeah, this is going to be it. So if there's anything else, more importantly, how's your dad doing?
My dad is doing well. So I spent some time with him this weekend. He does have some surgery coming up a week from today, Monday. It's not major, but when someone's 85, I think anything's kind of major on that. So thanks again for helping to move this along and getting things done.
Great.
And next meeting will be about a month from today.
Holiday.
Holiday?
You have a holiday on the 17th of
17th.
Patriots, it's a holiday, so it would be, actually, if I'm rolling it forward, it would be the beginning of March, March 3rd, I believe.
Unless something urgent comes up in town, then that's probably what it'll be. I don't know the date offhand, so
Okay.
it'll be posted. But chances are it'll be the beginning of March, the first Monday, probably.
However, if the town council comes back and says no problems with this, you would be able to go ahead and post the hearing, notice and all, without the board meeting, correct?
Well, we post the meeting of the Board of Health. You can have a public hearing here at your
Right.
meeting, right?
Right.
Oh, yes, you don't have to vote then to say, yes, no, we would have it.
I
And
just
on the
meant-
agenda item, we would say, given your, how this has moved forward, to say that let's say a date, that they come back and they have without any edits, that you don't have to look at it again, they give it a stamp of approval, I would go ahead and schedule that.
Right. So it wouldn't
Public
depend
hearing.
on our meeting before that happened. Okay, great.
I can understand what you're saying. That would get scheduled.
I'm just being optimistic.
Okay. But now let's, the other hypothetical, meaning if they have some language they want added, if they have some things, just full disclosure, if there's something, you would then have to, well, are we in
Right.
agreement? Do we want to insert that?
Right.
Is that part of it? Might that lead to some other things? That's not a public hearing.
Exactly.
Yeah, okay.
Got it.
Okay, so let's move on to number 3 here, and that's the Cranberry Bog.
Thank all of you.
And it's 16 Denver Drive, and it's only an update. So let's have an update. Thank you.
Thank you, Mr. Chairman. We do have a court date, a Zoom court date set for February 24th at 9 a.m. with them. The good news is the building department and the plumbing have received permits to do some deconstruction of the plumbing and the stuff that's in the building to eliminate the shower and stuff like that. There has not been a permit to abandon the septic, the current pit yet, though. So I am waiting for that. So that does look like they are moving forward with everything to comply with the town. So it is the 24th. There is an on-site meeting I just got an invite with Mark Rose, the deputy building commissioner, and Tim to go out and see, and they're gonna actually let them know exactly what needs to be done. And if I have any input, I'll give it also to myself. So it's moving forward, and if everything is done before the 24th, we might be able to not have a court date. So if there's nothing there to have a court date on, then that'd be nice. So
I have a question. I don't understand why there's 2 notice of probable cause hearings. The only difference I see is that,
one is Steve Wilson, the other is Brian Wilson. They're brothers. One lives off Cape, in Plymouth. The other gets his mail here. So yeah, I have to send it out to both owners. So
Gotcha.
it's the exact same letter, exact same everything. It's just,
and it said that this, and I understand this is just a copy of what was sent to them, that what does it say? That the information on what the hearing is about is attached, but we didn't get that with ours.
we did get that. I apologize. I can get that to you.
Okay,
It's-
I would like to see it, yeah. Okay, thank you.
Any questions?
In addition to that, I just wanted to make sure,
Yeah.
similarly, with this issue, the Cranberry Bog Buildings Department was referenced, but also the Conservation Commission as well, to see if they had any input, meaning you would move forward, maybe say, to approve a septic system, Title V, but they might have some disagreement, or they may have some regulations, and in fact, they do. It's a notice of intent. I reached out to Brittany, who oversees the conservation agent, and there's a notice of intent where a survey site plan for a septic system that is, it's requiring a septic system within the riverfront area or a buffer zone to a wetland resource. So there's some steps prior to even the Title V work that has to be done, filed with Conservation Commission. That's reviewed at a public hearing. I'm going off her email to me, voted by the Conservation Commission. It would require a variance also, because it's within the 50-foot setback of the resource area. And then an order of conditions would then be issued, and then there's a 10-day appeal period. So even predating any of our Title V work, Conservation Commission has to have. And again, there was a hypothetical here, because we've heard that there is no septic system, right? There is not a septic system. It's a rinse station. It's an outdoor shower that we have on any house on Cape Cod. Well, you saw the pictures. That's not the case. There is actually a septic system there, and there's a process for that. I'm not saying it can't be done, but Conservation has a process, and that's called they have to file a notice of intent, and then also the Title V, and those two go hand in hand.
And kind of complicating that is the whole waste management program.
So that's the pump station.
No, I'm not talking about that. I'm not getting into that. I'm talking about the fact that there's going to be sewering along that way. And so, there's the whole, for at least I would think these owners, the whole issue of putting in a septic system and then finding out they have to hook up to the sewer line anyway. Although I know we gave, I think, like a 2-year grace.
It's a 2-year, yeah.
Yeah.
In order to comply.
Yep.
But once that stem becomes available and abuts your property, you have a 2-year window to get that
Right.
done. And it's a gray water system. It's not as elaborate as obviously for a 3, 4 bedroom system. It's a gray water system, but there needs a system in place. And as you can hear from the Conservation Commission, this is within the 50-foot barrier
Right.
of a cranberry bog.
Shouldn't be a problem.
And there's, a washing machine and a shower.
Which is part of what they were talking about, the pump station that the owners were in terms of other issues that aren't ours. So.
Right. I really feel this is going to run through the courthouse loop here. It's not just the health department. Buildings department has several issues with them as well. So this is now actually somewhat out of our hands and into a clerk magistrate's hands. But we wanted the board to be aware. You had them in front of you. This is the next step. And sometimes some of this is frustrating because it moves real slow, right? Business moves fast, government many times, or at least moves faster, or government sometimes grinds a little slower.
Barry, I do have your explanation of the criminal actions.
Okay.
I have that explanation, but not the specific.
Ma'am, I'd be more than happy to get that to you.
Anyone else? Thank you, Barry. Okay, so number 4 on the agenda here is avian flu discussion precautions. And I think we have Dr. Brock joining us tonight, who's the Barnstable County Health Consultant.
Yes.
Welcome.
Here, can you hear-
Dr. Brock, can you hear us?
I can. How's that?
Lovely.
Perfect.
Okay.
That's great. Welcome.
Let me just cue this up a little bit, Doctor. I put this on, you've heard a lot of it on the news, in the media, right? As far as avian flu, there's a lot of concerns. Who does it apply to? What are the precautions? Residential, animal control, businesses and otherwise. People are concerned about this, their risk to themselves, their pets, perhaps. And so I reached out to the county and just asked, and I thought we need to get some advice, not only for the board to understand it, but also the community listening at home. And and Dr. Brock was gracious enough to say, just to give an overview, she's here to ask, to answer any questions that you might have and maybe steps moving forward. I've reached out to DPW. They have not picked up any birds. DNR, Natural Resources, where Animal Control sits, they have picked up some, and they also, I just asking, do they have PPE, personal protection? And they do. But I really, and by no means any kind of a subject matter, even expert, or have the knowledge that Dr. Brock has, so I really want to turn this over to her.
Great timing. Okay, we're listening.
All right. I teach at Mass Maritime in the Emergency Management and Environmental Health and Safety Department. And I did work for Barnstable County for about 25 years before I got my PhD and went over to teach full-time at the Maritime. But I still work under contract with Barnstable County, specifically with BCR, which is the Barnstable County Roundtable, Public Utilities and DPWs. So when we got alerted that that bird flu had been detected, I think the first one was Plymouth, and it was about 60 to 80 swans and geese in a pond located in Plymouth. But then when we did further digging about it, they basically said that there had been numerous cases and reports on the Cape also, some backyard farms, chickens, things of that nature, as well as other like avian, I guess you want to say, seabirds kind of thing. And so the communication is not forthcoming, which is disturbing to me as a public health person or emergency manager. But we did talk to Mass DPH, and in response to that, they helped us and sent, probably all of your departments got it or your DPWs got it. If not, just let me know and I can send it to Jay. So why are we concerned? I have been following bird flu for a long time, probably over 20 years. It emerged in Southeast Asia as H5N1, and actually it's highly pathogenic to humans. And so when it first spilled over, it's a spillover, which means it came from a mammalian source over to humans, and that's kind of important. It had a high case fatality rate of like over 90% kill rate, which is, breathtaking considering COVID, I think, was 0.1. But the good thing about that, if there was any good thing, is that it lacked the ability to transmit directly to human. So the only way you could catch it is direct and intimate contact with a bird, like by butchering a bird or aerosols or excrement, things of that nature, to a sick bird. So we've been following it for decades, surveillance, CDC and World Health Organization. And over the last, I want to say maybe 5 years, but certainly over the last 3 years, it's really been moving in the wrong direction. And what's been happening is wild birds migrate and they spill over to other mammal sources. So for example, if you've been looking at this, like harbor seals in Norway and chinchillas and, muskrats and, all of these different mammalian species all over the world. And what's concerning about that is every time it spills over to mammalian species, it has an opportunity to resort. It's very close to being able to efficiently spread human to human. And if that happens, then any spillover to a human being, if that resortment takes place, that human can begin to transmit it to other humans, and it will become more easily transmissible. I don't want to bore you, but we've been watching a case in Canada and a case in Louisiana over the last several months. And in both those cases, it was the high pathogenicity avian influenza. The Canadian teenager, they don't know how that person contracted it. He was comatose for months, and they haven't disclosed whether or not he's died. And then the case in Louisiana, it was a backyard farm, did have intimate known transmission to sick birds, did have coexisting, he, whatever, they don't actually tell these things for privacy, did have coexisting comortality. So it was immunocompromised. They were immunocompromised, and they did die. And so they were in coma for quite a while. But in both of those individuals, it had mutated within those individuals to become closer, if not capable of transmitting human to human. So it was resorting. That's the fear, is the more sick birds, sick animals, even though that's tragic in of itself, the more they come in contact with humans, the more possibility of a spillover or transmission. And so, it's almost, if I could say as an epidemiologist, that it is probably going to happen. It's just a matter of time. So that's why we jumped on that, because a lot of the DPWs that I work with, which is certainly your DPW too, they are usually the likely ones to be called to handle dead animals on the road or just dead animals on public spaces. And they usually do it. And most of them have an SOP, standard operating procedure for safe handling of dead animals, because rabies is also problematic for workers too. The problem that we had, for example, in the town of Barnstable, the animal officer will only handle 5 and over dead birds. Then there really wasn't a policy even for sick but still alive birds. So there's a lot of I guess there's a lot of open-ended policies within towns that it doesn't make it very specific who should be handling the birds. 5 and less, how about big birds? How about little birds? These were swans and geese. They hold more possibility of transmission because there's just more dander and there's more excrement, there's more secretions, things of that nature. So that was why we did that policy. So we sent that out, and the DPWs are hopefully following it as much as possible. But in addition to that, and if you haven't gotten the packet, which I'm sure Jay probably gave you the packet, we also suggested even maybe posting in town hall or libraries, for the general public, just some basic information in a fact sheet that DPH did provide about being careful not to find, even if you find 1 or 2 birds. Again, the closer it comes to human contact, and the closer, for example, the closer proximity we are to sick or injured or dying birds, the more chance there is for this spillover resortment. So I don't know if you have any questions. I certainly can speak a little bit more to you about it, but I applaud you for actually caring about it and becoming here, or asking me to come here to educate you.
Dr. Brock, I had a little bit of an input. I'm a wildlife rehabilitator veterinarian, and I work with WildCare. And I did a little research on this, and since, just to check, because whenever we get wild birds in, we run, we screen them for avian flu. And I can give you our numbers from December. So as of from December 9th to January 27th, we had 59 birds that we tested, 10 tested positive. That was, so that's comes out to 16.9% of the birds that were tested. So that was at WildCare, and we handle migratory birds and any other wild birds that are brought into the facility. The other thing is, I went ahead onto mass.gov and downloaded the 2 forms that are there for the public to fill out, and the disconcerting problem I found with it is they're looking for if you find 5 or more sick or deceased wild birds. It's pretty unlikely for the public to find, I think. It doesn't show any interest in a single bird or 2 birds or whatever. And so I wondered what your input on that was. And also, I found it hard for someone who's really, somebody in the general public that did pick up a bird like that to find guidance for what to do with one of these sick birds. So, currently, we take them at WildCare, and then there's a wildlife facility in Barnstable. But I just wanted to give you my experience so far with that that disease. And I agree with you. I think it's just a matter of time before that virus mutates to affect, become highly pathogenic to humans. So do you have any, the other question I had was, there was a lot of news media coverage of a large flock of birds that were found in Plymouth that were suspected of avian flu. Could you tell us if they were positive? We never heard any follow-up on that, and I had trouble trying to get some follow-up on whether or not that group of birds were actually, in fact, infected with bird flu. Do you have any input on that?
Yes, it was positive. They were positive. And, I want to commend you too. I love wild care. I actually have brought birds that I found to wild care. The surveillance that you're providing, there should be some outlet for you to provide directly to Department of Wildlife or to Mass DPH. Because that surveillance data, I'm with you. I think it would be rare for us to find 5 birds, and it would be rare. But yet, and many of the birds don't travel in flocks like that. In fact, many birds, crows, for example, will segregate themselves once they're sick. They won't fly with the flock. So birds have very distinctive behaviors, and different birds have very distinctive behaviors. So I'm with you. I found a robin, I found a blue jay in my area where my neighborhood is, and it clearly had died in seizure. And of course, some of the mechanisms where this affects birds is neurological, and this bird had died in seizure. It actually was in a head tilted back arch position, and it had died that way. So, that could be poisoning. It could have been, but it did not have any overt trauma to it. So, I did call the 3 numbers that were on the internet. None of them answered.
Right.
No one called me back. Finally, I persisted, and they basically said, we don't care about one bird. Just throw it in the trash and double bag it. And I don't agree with that, because I believe in surveillance, and surveillance in any way, even if it's, bird rehab, you would be an obvious person that they should be reaching out to and surveilling or having some kind of communication with you, because you're seeing this. If I can help you with your staff probably has excellent protocols because they are medical. But if I can help you with protocols, I'm happy to do that. My PhD is in occupational health and safety and emergency management. And so we're doing OSHA compliance to the cities and towns here on the Cape. What else did you say? You said a number of really good things. Public education is huge. One of the things that I want to relieve you in some ways, I've been, again, following this with actually Google Alerts. If you know how to set a Google alert for bird flu or high pathogenicity or emerging infections, you can get summaries of articles every day, and you can screen them for information if you are very motivated. But ever since 2019, the United States has been contracting with pharmaceutical corporations to develop avian flu vaccine. So there is some preparedness activities on a national level to create a vaccine for avian flu or high pathogenicity. And I do want to point out to you that this particular H5N1 high pathogenicity avian flu, I want to sober you guys to think that the kill rate or the fatality rate of this is anywhere from 30 to 60%. So that sobers you right away, 30 to 60%. And again, the other thing that I want to caution you is that it's also coincided with seasonal flu right now. And so my concern is somebody who could not be educated, be interacting with backyard birds or, even wild birds, and the secretions and kind of having no personal protection equipment could come down with flu-like symptoms and not even know or not even suspect that it could be, that it could be something bad. And that's what happened to the first 2 patients, the Canadian and Louisiana. They thought it was seasonal flu. They finally went into the ER, and they were turned away because they thought it was seasonal flu too, only to return in a coma state. And so if you can get to and now I do know DPH is providing surveillance in ERs, but you have to mention, and the doctor should be asking you if you have been exposed to any wild birds or sick birds. If you answer yes, they will actually pull a test for the avian influenza there. I don't know if it's happening at Cape Cod. I'm reassured by DPH that it is happening at all the emergency rooms. I'm not confident that it is. But if that happens, and you start Tamiflu or antiviral medications early within the first 48 hours, your likelihood of severe illness will be mitigated tremendously. But no one's getting the information, or very few people are getting the information out there. And that's the other thing I wanted to share with you, is this kind of information is invaluable. It's invaluable for anyone who might be. The other thing about the seasonal flu coincident with bird flu is I don't know how much you probably know a lot about viral interaction, but viruses are very peculiar. And if animals or people are co-infected with two influenzas, like seasonal flu and avian flu or any other flu, they resort very easily. And that creates like the perfect storm for the potentiality of variants that could transmit humans to humans or not. It's all random with viruses. So I hope that helps a little bit.
Yeah, I agree with you about the single bird. It's much more likely that the general public's going to encounter a single bird and not 5, certainly. And I think that's a major issue at this point. That the general public is it's pretty likely they're going to find a sick or dead bird if the bird dies. A lot of these people will handle these birds, and it does present a danger.
I've done it myself. I've rescued owls,
Sure.
I've rescued crows, and I've brought them up to Orleans to WildCare.
Sure.
And so, yeah, it's a reflexive things for people that are interested in that. What I do want to stress to you guys in the emergency management world, this is on a risk matrix. This type of spillover is relatively low probability, not possibility, low probability. So it's very probable, or it's on the lower scale of probability, but the risk and associated collateral damage is catastrophic. Do you know what I mean? It's like a black swan event. And so I think that's why most people tend to ignore it until it actually occurs. And so that's why, mitigating, situational awareness, being aware, and what I'm finding now because of the shutdown with World Health Organization and CDC is even Mass DPH isn't getting updates and getting alerts. So it's kind of like a weird perfect storm situation that hopefully will become resolved very quickly so we can get a lot of these agencies back on board doing surveillance and doing communication.
There was a lot of criticism of, I guess, a lack of transparency and a passivity about addressing the problem that predates the issue with the World Health Organization. People, what I was reading about is, didn't we learn anything from 2019? Just like to hear your thoughts on that.
As an emergency manager following this and understanding like the federal action, the Pandemic Preparedness Act, it wasn't even reinstated last year because of Congress. So yeah, am I concerned? Yeah, we don't seem to learn well. But again, it's one of those things where you have low likelihood but high catastrophic, like a black swan event. People generally don't want to put a lot of resources and energy and money into something that might not happen, but if it did, it will be catastrophic. And we knew we knew a COVID-like disease X was going to happen for 30 years. And, scientists have been saying, hey, let's be prepared, let's do this, let's do that. And you can't really drum up people being excited about that stuff until it happens, because so much goes on every day that occupies the brain, the money, the attention. But I agree with you. And, it's like watching a slow motion train wreck. You just be prepared yourself is the best you can do and convey information. That's why I commend Jay for even having me talk to you guys. You're the only Board of Health that has reached out. And, kudos to you, because that's the kind of public servant you kind of need in this kind of scenario. Hopefully it never happens, but I'll guarantee you it is going to happen eventually, whether it's going to be next month or 10 years from now. It's going in the totally wrong direction. So hopefully we'll be prepared. There will be a vaccine available. They're also in some other countries, they're vaccinating the birds. And I just read that they called in, I think, New York or Connecticut, they called a duck flock of 10,000 ducks who came down with H5N1. And then also, I believe it was H6N9 out in California. And so it's horrendous, it's like it is coming all around us. And there's a lot of economic damage and collateral damage and wildlife damage. So like I said, if you ever want more information, Jay has my email. You can reach out. I can show you a few websites for the Google Alert is great for surveillance because every day it sends you an alert of all the articles and everything going on in the world relative to it, so you can keep up to date.
Can you share with us your thoughts on the issues of consumption of food and any risk involved with that people should be thinking about?
Absolutely. Cats seem to be much more prone to dying from in their encounters with wild birds. So, for example, if cats are allowed to go out, and of course they do get wild birds, they hunt birds, and or they find dead birds that are ill, those single birds, again, that no one's even surveilling, they can die from it. And also communication with humans. It's not really known if transmission can occur between cat to humans, but I got to tell you, there's also a brand of this avian flu, as you've probably read, with cows and milk out in the Midwest to the West Coast. And that doesn't seem to be affecting cows. They don't know the mode of transmission, how cows are getting it. They don't know whether milk is going to be very affected. Anything cooked, like chicken or eggs or things of that nature, or milk that's pasteurized, will be safe because it allegedly kills the virus, but raw milk, not so much. And people that are getting sick with contact from cows with a lesser virulent strain of this virus are getting much less severe diseases, but they are like pink eye, and they're not dying though. So we've had 70 cases listed in the United States from that particular variant, 2 from the high pathogenicity variant, and I think both of those cases died. And the other thing that really frightens everybody is it may be already circulating out there with people who think they have seasonal flu, or elderly people that may pass away expectedly from seasonal flu, or immunocompromised people that might be passing away. And so it would make me feel so much better if they were doing surveillance in emergency rooms and in hospitals. There's a saying in diagnostic medicine that viruses are generally they're basically diagnosed with a symptom complex. If we have a PCR test, we'll do it, but the symptom complex during flu season will probably, they say in diagnostic medicine, if you have this symptom complex, then we're going to be more likely to diagnose a horse than a zebra. And that's basically, these people can be coming in hospitals all over the United States with this flu complex, symptom complex, and they're being diagnosed as a horse, when in fact they may actually be a zebra. And in which case it could probably even already be out there, similar to COVID, which was probably out there for months and months before we actually had a handle on it, which is just, interesting until it reached that threshold where it like flashed over and all of a sudden became, epidemic and pandemic. So I wish I could be not so Debbie Downer, but I would rather be prepared than taken off guard, because you can do mitigation efforts at this point, even if it's just an individual family or the town, or you can send out just information bulletins or fact sheets and post them in public places.
The Department of Public Health, Massachusetts, did issue a clinical advisory today for enhancing surveillance for human infections with HPAI and H5N1 and
Love
priorities
it.
for screening.
Love it. And that's what they should have done probably 3 weeks ago when they started getting cases. But again, they're running into problems associated with federal. The epidemiologists at DPH said they're not getting any info. This was last week, late last week. They weren't getting any info from Washington and CDC. And so But I'm so glad to hear that. Yay. And, you know, the more people that you can tell if they have flu-like symptoms and they feel like they've been exposed, they can go to the ER and say, I have been exposed likely to sick or injured birds, you know, and just get that out there so that they can be surveilled, or they can be, even if post-exposure prophylaxis, like antivirals, can be started, then that would be good.
Thank you.
You're welcome.
Dr. Brock, this is Jay. Thank you for the kind words. For the residents listening at home, the songbird that flies into the back slider and things of that nature. What level of concern, things of that nature? Because you can, if you listen to the news, you really need to get. This has been very helpful to get some good information as to what's the level of precaution that is necessary. What birds can a songbird be infected by avian flu, or what birds, what category of species are we looking at that are carriers here?
It's interesting, Jay. Actually, songbirds, because I have a backyard feeder myself, and so I researched that. You know, information can change because there's basically not a lot of research and data. But from what I've heard from DPH, songbirds they generally don't succumb. Raptors, it's highly pathogenic to raptors, shorebirds, geese, swans, but they also flock. You know, they hang in flocks and in groups, and songbirds generally don't. But I still keep my backyard. For example, I flush out the bird bath frequently and keep it clean. But songbirds, according to DPH, this could change, of course. Generally, they don't see it as virulent or as deadly as in other species. So, and I can send you some information on that that you can share with the board too.
Yeah, I would appreciate that. And also, you mentioned earlier in your comments that there's, so you called it a community advisory, something, a posting, things of that nature. I don't know that I have that in that, and I've given the board some information that came through the county, but a lot of it, quite frankly, was for animal control and precautionary measures for someone who might be handling that, but not on a general sense that we could maybe put up on the website and maybe even post it at our libraries or the senior center and things of that nature. So any of that information would be really welcomed.
I'll do that. I will do that tonight and send it out to you, and whatever else I can scavenge tomorrow from DPH. I did not know that I knew they were testing because one of my friends is a nurse for DPH, and they were doing screening for high pathogenicity avian influenza in Plymouth because of the recent kill. And so they were doing it there, but when I asked about like Cape Cod Hospital, they didn't really respond unless they just were told that they were to ask each individual if they knew they had contact with sick or dying birds, but that might not happen continually, you know? So I will send that, Jay, and thank you. Like I said, reach out to me if the board wants anything else or any other. I think communication is our best friend. Do I think it's going to happen tomorrow? No, but I wish I could say it was highly improbable or unlikely or impossible. But again, it's been moving in the bad direction for months and months and months now as you watch the surveillance. It's just getting closer and closer and spilling over to more different species. So.
Yep.
Anyone else?
Yeah, that's been our experience at WildCare. As far as the songbirds, it's mostly the migratory birds, the raptors, waterfowl that we're seeing that are coming up positive. The songbirds don't seem to be affected.
Right, because that does happen. It's happened at our house where a songbird flies into the sliding glass door, and you come and they've seen something on the news. Is this avian flu in my backyard? That kind of thing. Just so the community listening at home has an understanding.
Sure.
Hey, Dr. Bruck, thanks.
Thank you.
Thank you very much. That was really informative. Appreciate it.
So anytime, and just give Jay some questions and he can email me and I can provide information for you. I welcome knowledge. That's such a good thing to have. So thank you so much for having me tonight.
Terrific. I'll forward your emails onto the board as well. So thanks a million. So appreciate your time.
Not at all.
Okay.
Yeah, definitely. Take care.
Yeah, it'd be great to have her email. Thanks. Okay.
I would like to have something drafted that we can send out to the libraries and
Community center, the cultural center and things that were
Something
Senior
really-
center, yeah.
Really simple, 10 things or
Right,
whatever.
right. Just-
Yeah,
good information. I'll get that.
easy to read and remember.
Tremendous resource. I didn't realize the wealth of information that she had.
Yeah, that's great.
Okay, number
Is this-
5 here. Oh, sorry.
I see this safe operating procedure. Is this,
It came from the county.
okay.
Yep.
Is this something that we have in place and in practice here in our DPW?
Well, I had asked DPW, do you have things in place, procedures for that? And they said, we do have them in place, but we haven't even been called. DNR has been called, so animal control has, and I spoke with Bill Benetti today, and he mentioned exactly the same frustration that Larry Hillard, you've talked about, the five bird minimum. He said that doesn't make sense to him at all. He said, but they do have procedures in place. Good. Yep.
So where did this avian flu discussion come from?
So this one here, I didn't know if she was referring to that. All this information came from Barnstable County. So this is part of our excellence grant, where we get information from the county.
So,
Forward this.
so then did you put this on the,
So I sent this over to DPW, DNR, and to IT, and to say, is there a place that we could be putting this for the community to be aware?
because this is probably not really written, like she said, for the general communities.
Yeah, I get a lot of phone calls when people got it as an alert on their phone about this. That was all, that's why I had asked about it.
So that connects the dots of why you would ask, what was this? I sent it on to IT, rather, to simply say, let's get some community messaging. It sounds like, Mary, thank you, I didn't see that came out today. There's a information that came out from DPH?
Yes.
Okay.
Yep. It's a clinical advisory. I'll give it to you here.
Thank you. That's probably better suited for the website as well.
Well, I mean, it's really directed toward people who encounter patients who have a respiratory disease and say they have also had contact with dead or sick birds.
Well, let me,
It's for the clinical, for providers of care. It's clinical.
what Dr. Brock, she kind of referenced maybe a community messaging information. It sounds like that would be better.
Oh, yes, absolutely. And
see what I
better
get
than, and
tonight or
better than
tomorrow.
this, too. I mean, I'd like to have something that
Well-
we develop that's more tailored to the general public, what they would be
Sure.
needing to know,
So let's
and
put
what
that
they're
on the
asking.
agenda for next meeting. At least.
Yeah.
This is the best and
Or if
earliest.
you have a list of 10 things or whatever, we can
Well,
just,
and Dr. Brock, I think she said she would go ahead and work on something, so
that may not
hopefully-
take very long, so.
Right.
She seems incredibly knowledgeable.
Yeah, she sounds like she's really going to get on it, so, I mean, I'd be happy to work on something between then, the next meeting, if something comes in from her and she.
Yeah, send it to us, that's all. We can make it happen.
I'm going to forward to all of you, and you'll have her email. This is the best and the earliest that I had, and that's why I lifted it on out. Yep.
It's not something we need to vote on, we can just.
No.
Exactly,
send
this
it
is-
to the Senior Center or wherever else. for
But her
sure.
point of community messaging is critical, to ease some concerns and precautions in place. Yep.
And just make people aware.
Yep. And perhaps also over to the school department, as far and wide as we can with our messaging, be helpful. Yep.
Right. Okay, good.
Anyone else? Not, we'll move on. A lot of this is just updates here for this meeting. So, plastic reduction bylaw, public forums is what's listed, number 5.
So I put in the pack, so you have the information. You may want to hang on to this, because as we're going to move forward, I've given the town administrator a working list for a group that possibly come together, a cross-section of industry, recycling, Chamber of Commerce, Public Health, Select Board, Board of Health, to come together to see if they can craft a regulation, well, it's said a bylaw, but it may morph into a regulation. But from that, to get input from the community, from the industry leaders, I didn't know if the board wanted to at least start looking at a schedule as to, do you want to have on your agenda to have a hearing, to invite, a public hearing to say, what are your thoughts? What are I think might there be an incentive if we reached out to, some of the legislators and said, listen, if a restaurant went green, might there be a tax incentive to that? How do we incentivize this? How do we move that? Just some thoughts and some things, and bringing people to, would invite legislators, invite the business community in to say, listen, we want to move in this direction for environmental reasons. What are your thoughts? What are the challenges, and where can, you know, where can we make progress on reducing plastic in the environmental stream? I didn't know if you said, is that the direction? I just want to get a sense from the board is, well, what are you waiting for this board, the group to come together? Do you want to start looking at an upcoming meeting? Maybe, well, here we are, sometime in March or into April to say a couple public hearings, invite people in to get their best thinking. Good and bad, let's hear from it.
So this is the select board's responsibility, though.
It really is the select board. I was just taking the lead because, you know, I stood up at a meeting and said, we're going to move
Understand,
forward on this.
But I'm just
Yeah.
trying to make sure I understand the politics of this, and because we've already kind of had a false start on this whole regulation. I would almost rather have, I mean, the process we've usually used, we've come up with something, and then we've had a hearing. So, you know, I have no problem with asking for people for input, but I'd like to have it, I'd rather have something in hand and say, this is what we're thinking about, this is what we have in mind, and then ask for the public's response to it. In terms of legislators and incentives for restaurants going green, I'm not sure what you mean by that.
You know, sometimes you have to incentivize, you know, making sure, reducing that. Is there something, it's just a thought that doesn't exist anywhere, to say, how do we incentivize for the community, for the business community, to say, you know, if you do this, perhaps there's all kinds of environmental, you know, things that can be done. Might there be an incentive for that? I don't know.
Well, I think the main incentive is people doing business with the establishment, especially in a town where they've voted on this reduction of plastic.
Yep.
You know, to me, that's one of the biggest incentives, is that these people are doing their best to eliminate plastic in their businesses.
I did include in your pack, and it's just simply, it's a template. It's what the town of Falmouth has.
I
It just-
think that's a great start. I've read that. I read that previously, and it's complicated, but it has to be, because
Yeah.
it's not a simple answer like our original, you know, ruling was.
Citizens petition is how it went. It was a citizens petition that was put forward. It could have been interpreted a number of different ways, quite frankly. I only put that in as a suggestion. That's not something, the group hasn't come together. I've put a working group together that I think makes sense for the town administrator to think about. I think it would be authorized, Mary, to your point, by the selectmen. I'm waiting for that while you were coming together, just to get your sense of, well, okay, we're going to wait for that group to come together, and or do you want to have it at an upcoming meeting, near or, you know, somewhat future, that you might want to have a public hearing on it?
It would be nice if it's on their agenda.
Is it
don't
on
know if it-
the select board's agenda?
I asked exactly that. I said, and I think with budget and some other things, it hasn't gone, I'm not making an excuse, I'm just simply saying it. I'm hoping, and matter of fact, I asked last week, has it made, because I don't want to jump ahead, I have actually even provided to you folks, so it isn't a public document yet, it's to the town administrator, and I'm hoping the selectmen will say, give it the green light that we move forward, then you'll know. Then we have a working group, because there was some, you're right, there was a difficult meeting, that the town, where there was just said, no, the community, they voted to say, we want to move forward with this, and said, well, this is just a way to kick this down the road, and I can tell you, it's not. But we want to make sure we have something that is achievable, that's solvable, works for the business community, works for the customers, works for the environment. I'm committed to make sure we do move this forward, and I just want to try to expedite this as soon as we can, so yeah, hang on to those in your pack, so I don't have to keep giving those. Hang on to those. This plastic reduction, you have the sample of the citizens petition, what happened at that special meeting, they're just calling that, but the Falmouth, and there'll be others, but I just trying to get a sense of the board of how do you envision moving forward with this? Because you will play a role.
Yeah, I agree with you. I mean, the model we've used for a lot of years now is having something for a regulation draft for the public to address. Otherwise, it often doesn't get very focused. People have ideas that are totally irrelevant. I mean, that aren't meaningfully.
And if we have this hearing and the group, the select board decides to have this committee, but they haven't commissioned it yet, then it could be confusing to the public. Okay, well, what are you doing now? The select board's got a meeting, and so what has all of this been about, and how are you gonna use that? I mean, obviously, we can use it because you're represented on the board, so you would be able to say, well, we've had some hearings that, I just think it would be complicating things, but I also agree that the clock is ticking again.
That's exactly, that's what.
And now, we're just saying, it's going to be in place next year, and yet, we're in this year now.
And Mary, I would say, I would build into that time frame that you just talked about, 3 months of just community education. I think that this is going to have to be built sometime summer, maybe late summer, and then the fall for a January start, would be community messaging this as out to the community in a number of different ways. So you can take 3 months off of that, in my opinion, is just having that document crafted, and now you're just letting the community know, Phil, our inspectors, Barry when he's out, any interchange with applications and otherwise, have you seen this? Do you know this document? How can we help you? The chamber, them holding some meetings. So I just thought, it sounds like a long time. We push this down the road for a year. It's not that long.
Right.
Yeah. So the sense I have is that the board would like to, let's get the working group in place, to come to some kind of, several meetings, to have some sense of shaping that.
Right.
And then come back to the Board of Health.
Sure.
I don't know if it's going to be the Falmouth, I keep calling it, it's just a template that a format that you can look at.
We really have no idea what the final product will be. When you got a table of 12 people around it, you don't know where it's going.
Yeah, no. Yeah.
Okay.
Yeah, committees can be interesting.
Anyone else?
I just keep thinking about this. Seems like a real contrarian green agenda that starts at the federal level at this point, that I wonder if our timing is okay.
What do you mean?
Well, I mean, it just seems contrary to what we're hearing from Washington as far as any kind of,
We're public health.
yeah.
We have our mission.
As long as we want to remain relevant. Yeah,
Climate change is.
absolutely, I agree, totally agree, but it
Disputed, yeah.
seems to be totally disregarded at the federal level at this point.
Well, yes, but my intention is not to have it disregarded at the local level.
I just think about the timing at this point. Would we get could we make it relevant at this point, the way things are right now with, as far as federal government goes,
Relevant to whom?
to the general public?
Well, I think, I would hope that the general public that spoke about this reduction of plastic was doing it apolitically. They were doing it because they're concerned about the
I
environment.
totally agree.
Whether or not the federal government at the time considers it important or not. I mean.
Well, certainly at the
Just
time.
like tobacco,
did.
we lowered the age limit
Mm-hmm.
before the state did, and before there was more of a national movement. So a lot of times things start at the local level.
Right. I just think we've done a 180 in the last 6 months as far as a green agenda.
Public health is very threatened right now. I'm very disappointed because after COVID, there was a pretty good movement toward bolstering the public health system, to building it up more, because people realized how important it was during the pandemic. And now, now we're just seeing it being taken down. And so these are not good times for public health. And I'm speaking as a public health professional. But it doesn't mean that I want to stop doing things that will protect the public health.
I just don't want you to join Anthony Fauci in losing your
Protection.
protection.
I intend to buy a pit bull.
Maybe two.
Thank you, I appreciate your concern.
Just a thought.
I think I am not high on anybody's list yet.
You're not a high-risk a target yet? No. That's so
Well, I mean, there are some U.S. Marshals who are retiring, and they are looking for work. All right. Plastic done. Permits, licenses, and update. I'm not sure what this will bring. What's up?
Thank you, Mr. Chairman. I got some great numbers for us. Overall, for food establishments so far, we have a total of 155, annual 115. 7 are not received. Those are, I think they're in construction, doing some limbo stuff right now. That's why we haven't filled out the got them yet. The seasonals, out of the 40, 20 have not received, which is very normal. They're not even here right now, so that's good. The annual licenses for the 5 nonprofits, we're good with that, and we have 2 residential kitchens, which are good. Retail food, of the 44, we're good with that. 3 have not done the retail. Those 3 are doing some revamps of their kitchens and restaurants right now. All 27 tobacco licenses have been renewed. Motels, inns, and lodges, a total of 59. The annual is 19. One of them is closed for renovation, and we have not received that one. And the seasonals, of the 40, 28 not received. Once again, the seasonals are not, they'll be coming along down the pipes pretty soon. Swimming pools, kind of same thing with the seasonals. Most of those have not been done, but of the annuals, all 18 that have annual licenses for pools indoors with pools and hot tubs, they have all been received. So Phil's up on date with that. Hazmat, all 172 permits have been issued as of today, which is great. Rentals, we have, as of today, 582 certifications have been issued. So far for 2025, 119 inspections have been completed just so far for the 2025 season. They have almost 175 inspections on the books today, so which is really good. What else do we have? We have 1,687 rental registrations that have been applied. That's about 53% of what we're going for, so which is really good. The housing department's working on that really hard right now. And that 53% is up from last year at the same time. So the new program with OpenGov and the 2 housing agents are working very hard on that. So last year, 2024, there was a total of almost 3,200 rental certificates altogether. So we're on great par moving forward with this new program. It's easy to share information amongst the department and other departments just with clicks of buttons for us to know where we're at and how we're doing. One of the big hurdles is when people renew, like for new people, a lot of our population isn't computer savvy. So once we get them in there next year, or the second time you're around, the other information's in there and it's just a click of the button. So that's what's making it a lot easier for our team to work on these. So we're very proud of them. They're working hard and doing all their inspections and
A lot of work.
yeah.
So how do you know when there are new people renting? I mean, new rentals?
That's a honor system, honestly. It's, every year we have people sell, people buy. So, we send out, renewals to the addresses, and say you purchase a home and you're like, well, I'm not renting. So there's an affidavit you can fill out to say you're not renting. Or you buy a house that's never been rented before and you want to rent, you come down and we can start the process there, so.
So for every new home purchase, they receive,
No, we're not that proactive. That's a lot of houses that are bought and sold on Yarmouth, so.
not lately?
It's through previous rental history is who we stick with,
Okay,
so.
Additionally, I would say this, Mary, this is a great point, because different, you know, to have this kind of catch me if you can kind of program is difficult, right? We're never going to get everyone. What are we missing? We don't know, but we also check the Department of Revenue. They have their spreadsheet, so people are paying taxes on that, and we cross-reference that, and do we have them in our system as well? Barry just mentioned about a little bit north of 3,200 short and long term. We don't know. I would have to imagine we don't have all of them. I'd like to think that that delta is fairly small. The other part too is we go inspectors that are out even across the hall, buildings, wiring. If they see ads of or a lawn sign or something of that nature, social media, we look at that. We look at Airbnb and things of that. That gets cross-referenced. We have interns over the summer that are looking at that for us. They're scanning those websites. But my point being is inspectors will look to say and send back an address that might not look familiar. So we have some surveillance to say, can we catch? We can't. Do we have everyone? No, I don't think we do. I think they're doing a very good job of catching and then identifying. We'll call it identifying them. But more than anything, the numbers you just heard go to where we're a little over 30 days into the calendar year, and that's just the business community is helping and working with us because there's a lot of time and effort that can be spent. Second notices, Carl's group, Phil's group, time and visits and stops, and we dropped off the application. The manager wasn't there. We need those returned back in again because then we have to then set up an appointment and scheduling and a lot of time and effort. They're helping us tremendously. So the message is getting through, and really like to applaud the business community, and I think some of this is even our relationship that we've built with the Chamber of Commerce. The messaging is getting out to work with us. We have limited resources here. We want to help. How you help yourself is to get involved with the health department so that we can help you, whether it's your customers, your property, right? We're a third objective party to come in and say, on such and such a date, we looked at your property and it's in substantial compliance with the state sanitary code or Chapter 2, the minimum standards for human habitation. That's an insurance policy for that property owner. And it's a business. There's a lot of money at stake here. We come in and we guide them, and it helps also for us to monitor the housing stock in Yarmouth. So those numbers are compliance is on the upswing. We're up and to the right on compliance. I say compliance, meaning renewing applications, we'll call it that. They're coming in, and that saves tremendous amount of time for us.
May I add to that? What's talking about numbers, Jay? Some of our bigger clientele, Davenports, some of the other larger ones, we're in the process of getting those started right now also. So those numbers don't reflect these numbers I got right now. So that's 500, 600, 700 right there, just waiting to be processed through. It takes Mo a little bit to do it, but she's working hard at them, so.
Barry, do these short-term residential vacation rentals, do they have to be permitted?
Oh, yes, 100%. And now with the new building code, short-term rentals, anything under 31 days, they have to be inspected yearly, not just by the health department, by the building department also. So there's special regulations that are going in right now. That's one of our new agents that Jay and Mark hired, that he will be certified to be able to do both those certifications for both the building and the health department, so.
So most of these, or a lot of them, are owned by corporations?
No,
Oh,
it's,
they're individual?
yeah, we got a lot of both. So it's, a lot of people have second homes that want to
But you
offset
see
their
these
mortgage.
signs that say, I need a vacation, for example, on a sign on the
Yeah, so
lawn.
they're the management company, like VROB, not Davenport, Del Mar. There's a lot of big management properties out
Right.
there, so you don't have to do all the legwork yourself. They take a percentage
Okay.
of the weekly rental.
Do they communicate with you, or do you have to
They-
communicate
that-
directly
The
with?
good thing is they know that they're supposed to have the rental certificates and all of that stuff. So they're good about the new people coming in, as Mary's asking, say, hey, I want to rent my house. All right, well, do you have this and this and this? And they're like, no, well, all right, you need to do that. So they're good about being our secondary education and eyes out there, so they're great about that.
Good.
And we have reached out, I know our housing department has reached out to a lot of the bigger rental companies, VROB, I would need a vacation, Del Mar, stuff like that, and let them know the new policies and regulations that are coming down the line.
See.
Larry, just so you're aware, and the board is aware, we spend our vast majority of our time, if we divide labor, it's with annuals. The seasonals are in very good shape, right? This is a business, right? So they come in and,
Right.
quite frankly, luxurious, many of them. As we look at the time that's spent by our inspectors, vast majority is over here in the annuals. And those are the ones we're trying to make sure that property owners, maybe absentee landlords, that they're taking care of those properties. The others, just the market takes care of themselves, where they are in very good shape, and the owners, because of the rents that, and the business opportunity that's available to them, they make sure that's a showcase. So, yep.
Okay.
Thank you.
You're welcome.
Mass Association of Health Boards guidance document. We all had something in our packet. Anything?
Yeah, this was just, actually, quite frankly, this illustrates what you did last year, I think, as far as putting in a food safety consultant. Before this was even published, you followed this, you kind of were ahead of the curve on this. I guess it's just to simply say, it's another tool for the board to know that if we're having difficulty, and you might, this happens, where food establishments aren't coming on board, not to be punitive, but to be a guide and to be helping them to simply say, here's something to bring in a food safety consultant, which you have done in my short time here, you've actually done that. But this is a documentation explaining as guidance for, a lot of boards of health aren't as proactive as your group, or don't have this, maybe the knowledge base or the wide berth of background that you have in public health, or the experience, we'll call it. This is just another piece of use that can guide you in, if the scenario presents itself for a struggling food establishment, to say that we're going to bring in a food consultant is another avenue, and not to put them out, not to close them, but to simply say we want to work with you for the next X amount of 3 months, 6 months. I forget exactly the time frame that you worked with, and I know the restaurant, but you brought them back on board, and I asked Phil that, as I put this in your pack, and he said, it's turned around completely. They're doing wonderfully. So look at that. Exactly right. It worked. So this was just simply a point of information, and just so you're aware that in the future, you may use that again.
I need a copy.
Oh,
I
you
didn't
didn't?
get one. I've got a lot of stuff here, but anyway.
Okay.
Thank you.
It outlines what the board used
Okay,
in the past, hiring a food safety consultant for, because otherwise, our inspector Phil is there a lot of time, a lot of handholding, and more than anything, the top priority is the public at risk. That's the concern.
Would you want to eat there is the bottom line.
There you go.
Okay. Number 8 is to accept the minutes from January 6th meeting. Did everyone get a chance to read it? I didn't have it in my packet. I didn't notice that until this morning when I read the packet, so I didn't have it. Anyone else?
I didn't have it either.
Larry, did you have the minutes? Charlie, in your packet with the minutes there from the meeting?
Do I have them?
Yeah.
Was
Did
it in
you
your
receive
packet?
them? The minutes? No. From the January 6th?
Can
You
we-
did not. Okay, so we'll have.
Can we hold, you, the chair?
Yeah, we'll just,
Sure.
next meeting, that's all.
Yep.
Okay, new or old business? All right, Don't get online too quickly here. Okay, let's move on. Nothing new and nothing old. Great. Number 10. Anybody? It's called
Move that we
adjournment.
adjourn.
Thank you. Anyone want to second such a thing? That's
Second.
you, Eric. All right, for the minutes, Eric. Okay.
That's okay.
All in favor of going out of the door at this time?
Let me have
Everyone,
my
just raise your
glory
hand.
last
Oh, no,
time.
you have something, Jay?
Next meeting, just set the date. I think it's the 3rd of,
So the
Third of
first
March.
week in March.
the 3rd of March. I just didn't know if everyone heard that and you're.
The 3rd?
The 3rd?
Of March,
Okay,
yeah.
just make sure, 3rd of March, Monday, next meeting.
First
next-
Monday in March.
We have President's Day, we're, we're not meeting on the 17th. So it's
We'll
on,
sneak that in as the new business.
There you
Now,
go.
Adjournment, we're still, we
Yep.
just have to vote, guys.
Yep.
Okay, all in favor of leaving?
Aye.
Raise your hand. Okay, we're all leaving. Thank you, everyone. Good evening.